Hi, I am TRICYCLIC antidepressant, and my drug classifications are amines, secondary amines, and tetracyclic. And the drugs under the amines are and for the secondary amines, these are and lastly, for the tetracyclic is
I hear birds singing, I see trees are dancing, and
my mechanism of action is inhibit presynaptic reuptake of the neurotransmitters 5-HT and NE, which leads to an accumulation of these neurotransmitters in the synaptic cleft and increased stimulation in the postsynaptic receptors. The exact mechanism of action in decreasing depression is not known, but is thought to be related in the accumulation of NE and 5-HT in certain areas of the brain.
Pharmacokinetics. I am well absorbed from the gastrointestinal tract and has a peak level in 2 to 4 hours. I am highly bound to plasma proteins and are lipid soluble. These allow me to be distributed widely in tissues including the brain. I am metabolized in the liver and excreted in the urine, with relatively long half-lives, ranging from 8 to 46 hours. I can cross the placenta and enter the breast milk.
My indications are: first, relief symptoms of depression. Some are effective in treating enuresis for children older than 6 years. Also, some of these drugs are being investigated for treatment of chronic intractable pain. And lastly, clomipramine is now being approved for treatment in obsessive compulsive disorders or OCDs.
Contraindications. I am contraindicated in patients with hypersensitivity towards me, myocardial infarction, myelography within the previous 24 hours or in the next 48 hours, concurrent use of an MAOI, and the pregnancy and lactation. You should use me with caution in patients with pre-existing cardiovascular disorders, angle closure glaucoma, urinary retention, prostate hypertrophy, GI or genitourinary surgery, psychiatric patients, manic depressive patients, suicidal patient, history of seizures, and hepatic or renal disease. Adverse and side effects. For the CNS, sedation, sleep disturbances, fatigue, and suicidality. For cardiovascular or orthostatic, hypotension, hypertension, arrhythmias, myocardial infarction, angina, palpitations, and stroke. For the GI, dry mouth and constipation. For GU, urinary retention and loss of libido. For others, alopecia, weight gain or loss, flushing, chills, and nasal congestion.
For the nursing responsibilities, first is the assessment. During assessment, one should assess the patient for contraindications or cautions. Next is assess for temperature and weight, skin colors or lesions, affect orientation and reflexes, pulse and perfusion, respiratory rate and adventitious sounds, and bowel sounds on abdominal examination. And for the nursing diagnosis, acute pain related to anticholinergic effects, headache, and CNS effects. Decreased cardiac output related to cardiovascular effects. Next is disturbed thought process and disturbed in sensory perception. Next is disturbed in thought perception and sensory processes related to CNS effects. Also, risk for injury related to CNS effects. Lastly, deficient knowledge related to drug therapy. And for the planning and implementation, limit drug access if the patient is suicidal, Maintain the initial dose for 4 to 8 weeks. Administer parenteral forms of drugs only if oral form is not visible or available. Switch to an oral form. Administer a major portion of dose at bedtime if drowsiness and anticholinergic effects are severe. Reduce dose if minor adverse effects occur. Discontinue the use of drug if major or potentially life-threatening effects occur. Also, provide comfort measures. Provide thorough patient teaching, including drug name, prescribed dosage, measures for avoidance of adverse effects, and warning signs that may include possible effects. Instruct the patient about periodic monitoring and evaluation. And lastly, offer support and encouragement to help the patient cope with the diagnosis and regimen. And for evaluation, monitor patient response to drug, also monitor adverse effects, evaluate the effectiveness of the teaching plan, monitor the effectiveness of the comfort measures, and compliance with the regimen. That's all for my autobiography. Thank you for watching.